All right, what's up, guys? So, look, are you getting stuck on the lower doses of Suboxone? And if you're tapering, then the answer is probably yes. Let's talk about it. All right, so let me take this opportunity to remind you that this is not specific medical advice for you. This is just a discussion and how sometimes I have helped other patients who have faced this problem. I want you to talk about your medications and your plan with your doctor, okay? That being said, let's talk about it. So a lot of times people are tapering. They're using the very slow method, going very low dose and very slowly, which is typically what I recommend to most people. And let's say they get down to like 0.5 milligrams, okay, of buprenorphine. Now, think about it. If you get a 2 milligram, most people are taking 8 milligram tablets or strips of Suboxone. But you can get the 2 milligram ones, okay? And so if we cut that in half, we've got a 1 milligram. If we cut that in quarters, we've got 0.5 milligrams. Now, you can, if you're able to cut those in eighths, well, there you go, all right? So we're trying to get people down to 0.5 milligrams to 0.25 milligrams. And at that point, when you're taking that every day, we then just spread out the timing. So instead of every 24 hours, you're going to dose every 26 hours. And then, after several days, this could be 3 days, this could be a week, you push it out to every 28 hours. And then you push it out to every 32, every 34, every 36, etc. Okay? And you might be able to make bigger jumps than that. You might be able to go from 24 hours to 36 hours. Okay? But my point is, most people at that point just have to kind of determine how their body is responding. And so they may decide that, no, I can't go 36 hours, but I can go 28 hours just fine. And they may have to stay there at dosing every 28 hours, for the next week, the next 2 weeks, the next month. Then they push that 28, on to 32 to 36 or whatever. Now, does this get a little wonky with your schedule? Yeah, depending on what times you're taking it and how that falls, you've got to really kind of keep up with it. So is it easy? No, it's not easy. But I mean, we're talking about tapering off buprenorphine. So no, it's definitely not an easy thing, but it can be done. I just saw a patient in the clinic not too long ago that tapered off 2 years ago. They've been off of everything for 2 years. Okay, and I see that patient for other medical problems, and they're doing fine off of their buprenorphine. They don't even hardly ever bring it up. Okay, we're dealing with other things now, other medical issues, and so I know it can be done. And this patient happened to use this very same method. Basically got down to like 0.25 or 0.5 milligrams. I don't remember exactly their routine, but every 2 to 3 days. And they did that for probably 6 months. And then they had a week off of work and just said they weren't going to take it that week, and they did it, and they never noticed a thing. And they never took another dose since then. But this process was after of us, working on it for a year or more. I don't remember exactly when we started the taper process, and I think he'd already kind of gotten down to maybe one a day before we really started going after it. But still, it did it very slow. And got down to the low dose. It was on a very low dose, lower than 8 milligrams, but was on a very low dose for over a year before completely tapered off. So it can be done. It just takes some planning. It takes some thinking through. It takes some, adjustments based on how you respond. So you can't think of anything as a failure. Just because you have a setback, it's not a failure, okay? You just have to make some calculations and make some adjustments and use it to learn and do better the next time, okay? Like, you may be doing really well, and then you may have to have a surgery or something. And that surgery, you may decide to use the buprenorphine for pain control, so you might have to up your dose for a while. Well, then it could make it difficult to get back down to your low dose, but you can because you've already done it before. You know you can do it. All right. So don't look at things as like as a setback or a failure. Just keep pushing forward and plan and rearrange your goals if you have to. You've got to be flexible. Okay. So always keep your doctor informed of where you're at. Hopefully your doctor is very involved in your process if you're tapering, if you're even ready to taper. Not everybody is ready to taper. So I do a lot of taper videos because that's what a lot of people want to know how to do, but not everybody needs to taper off right now, okay? Some people need that safety net of the medication while they work on their recovery. And we've talked about that many times, many videos talking about recovery and how the medication is not the recovery, right? The medication helps. It helps the brain chemistry. It helps you. It just gives you a cushion so that you can get your life on track and get out of the cycle of drug use and the cycle of lies and the cycle of self-destruction. So, all right. So, did any of that make sense on the tapering off a low dose? You get down to a low dose, 0.5 milligrams, maybe 0.25 milligrams every 24 hours. Once you feel somewhat comfortable with that, you then try to spread out the timing of the dose. So every 28 hours, maybe every 32, maybe every 36. And you're going to stay at that timing depending on your body and on your physiology, how you're responding. Are you having withdrawal? Are you having cravings? What's going on in your life? And then you're going to take the next step, push it out a little further. And so when you're taking a dose every 48 hours to every 3 days, every 72 hours, when you get to every 72 hours on a very small dose, at some point you're going to realize, okay, you're ready to stop it. Okay? Now, once again, talk to your doctor. I'm not telling you how to taper specifically. I'm just giving you an example of how some of my patients, how we've been able to do this, and they've done fine. Okay? All right, guys, thanks for watching. If you have questions, if you have other ideas for other videos you want me to cover, let me know. I've done similar videos to this before, but I had some new questions that were basically on the low dose taper, and I thought we would kind of go over some of the basic principles once again. All right, thanks for watching. Peace. God bless.